Hi, everyone. Thank you so much for coming. It's amazing to see so many students interested in lifestyle medicine. And really, Layla and Jennifer have been doing such a great job getting us up and going. It's not been easy for them. So this opportunity for you to join this group is really amazing. So we have to thank them for getting it started. I thank them all the time. So congratulations to you. As Layla introduced, my name is Marissa Kajabi. I've been living in Maryland for about 10, 12 years. I currently live in Canton. So if you live in Canton, you'll see me around. I walk and run there all the time. And I graduated from University of Maryland Preventive Medicine residency program in 2020. I had a baby, and then shortly after that, I joined as the associate program director for the preventive medicine residency program. Additionally, I am OBGYN outpatient right now at a federally qualified health center called Chase Braxton. So when I'm not here, I'm there. So it's a nice mix of education and also seeing patients, which is what prevention medicine and lifestyle medicine can do for you all. I'm board certified in preventive medicine and recently in the last year got board certified in lifestyle medicine. So today, I'm going to go fairly quickly because there's about 50 slides and I want to give time for some questions. But feel free if you need to run out or if you have questions in the middle, if you want to come up and get more food, keep eating, just please feel free, whatever you need to do. Okay, so this is an overview and by no means comprehensive and not in all detail. This is meant to be a high level overview of what lifestyle medicine is as a specialty and how you will use it no matter what you go into. If you go into even emergency room medicine, lifestyle medicine is still in there somewhere. Well, it's not going to be the first thing you think about when the patient's bleeding to death. Somewhere along the way, when the patient comes back the 10th visit later, at some point you'll be thinking about, hey, what's going on? Where can we help them so they don't end up back in the hospital again? So let's see. So here's our agenda. We're going to briefly talk about the chronic disease epidemic in the U.S., the 6 pillars of lifestyle medicine, common ground between medical specialties and recommendations for lifestyle medicine, quintuple aim, and then the College of American College of Lifestyle. So I have no disclosures. I already talked about that I work at 2 places. So in general, in the United States, chronic disease prevalence is going up. We can look at these numbers and we can really see that unfortunately the US is really impacted. This is more than infectious diseases. Chronic diseases are going up and chronic diseases are mostly related to lifestyle causes. So 4 in 10 adults have 2 or more chronic conditions. So 40% of adults in the US have 2 or more chronic conditions. When we think about that, that's crazy. Think about your parents, think about your aunts, uncles, line them up, 4 out of 10 of them are going to have at least hypertension and diabetes or kidney failure and diabetes, or you name it. But it's a pretty significant number and it's very sad to think about in that way. And we know overall 6 in 10, so 60% of adults have at least 1 chronic disease. So again, as we think about our parents and our loved ones, our grandparents, as they're aging, we need to think about what's driving the chronic disease. Why are we getting chronic diseases? We're the #1 country in the world. We're spending all this money in healthcare. What is causing the US to get all of the chronic? So what are the causes of chronic diseases? So they're mainly driven by unhealthy lifestyles, unfortunately. So tobacco use, nutrition, physical inactivity, excessive alcohol use. What is not on here would be stress, mental health, sleep deprivation. Those are also contributing. But these are the 4 leading causes of what is driving chronic disease rates to go high in the United States. And unfortunately, very few Americans lead a healthy lifestyle. So what is defined as a healthy lifestyle? So #1, you should be exercising. So the recommendation is moderate or rigorous exercise for at least 150 minutes a week. A diet score in the top 40% of the healthy eating index. a body fat percentage under 20% for men and 30% for women, and not smoking. So if we think about ourselves, think about where you are in these categories, and only 2.7% of the population has a healthy lifestyle. This slide is showing that out of countries that have higher development, that the United States is #1 in causes of avoidable death. And at the same time, this is showing that the United States is spending most out of all countries. And this shouldn't be a surprise. I'm sure you've heard this many, many times in medical school. But why are we putting all of this money? Where is all our money going? It's not going into lifestyle medicine. It's not talking about preventing disease. Usually, the spending that we're talking about is someone who comes into your office who's been diagnosed with a condition, and then we're giving them medications, or pushing medications, or pushing surgery. We've found with lifestyle medicine that these things are preventable, and they're also treatable and actually reversible. 90% of the nation's $4.1 trillion in annual healthcare goes to chronic disease and mental health conditions. So we should be spending money on other things, infectious diseases, pandemics, COVID. Instead, it's being spent on chronic disease. Unfortunately, in the United States, the life expectancy is dropping, which is really sad. And if you look at other countries that have similar demographics as us, countries are not dying younger. But in the US, we are. So we really need to look at ourselves and figure out what is going on. And the answer really is our lifestyle. As our lifestyle spreads to other countries and other nations, they've been developing higher rates of chronic disease as well. So what is lifestyle medicine? So lifestyle medicine is a specialty that uses therapeutic lifestyle interventions as the primary modality. So the very first thing to treat chronic conditions. It is similar to other, it can be used in other specialties. For example, if you go to family medicine and you have a patient who has hypertension, then you may recommend a DASH diet. You may be talking about exercise. You may be talking about decreased smoking. Lifestyle medicine is different because it is the first specialty that does not go to medications first. It doesn't go to treatment first. It goes to lifestyle first. It gives the patient an opportunity to work, to use lifestyle medications to treat and reverse conditions. So if a patient comes with a blood pressure of 160 over 110, you're not going to say, okay, go home and eat broccoli. No, you're going to give them the medication. But lifestyle medicine is developed so that over time, you can get patients off their medications and reverse their conditions and make them healthier than they were before. So lifestyle medicine is not only to prevent, but it's also used to treat and reverse lifestyle-related diseases, which are the chronic diseases. And then just talking about briefly about what preventive medicine is, because lifestyle medicine and preventive medicine go hand in hand. However, the difference of what preventive medicine is in the residency that I'm associate program director is that we do the practice of promoting preventive healthcare to improve patient well-being and ultimately to prevent disease, disability, and death, not only in individuals, but in whole populations. So lifestyle medicine is focused on an individual patient. You may become a lifestyle medicine physician and you may open your own practice. You may see patients. Lifestyle medicine is really one-to-one with a patient. Preventive medicine, yes, we do individual patient care, but it's also focused on the whole population. So you may work at a health department, you may work at the FDA or the CDC, you may become Surgeon General someday, but you're looking at not only individuals, but you're learning how to treat the health of whole populations. So a preventive medicine doctor who practices lifestyle medicine may have a lifestyle medicine clinic and treat patients individually, but also on the side, I may be working on policies related to lifestyle medicine, getting healthy foods into school, taking away bad lunches in Baltimore City schools, advocating in legislature for some of these issues that relate to prevention and prevention. So while many fields do have lifestyle medicine incorporated in some way, that's the main difference between lifestyle medicine and prevention. So what makes lifestyle medicine so magical? Well, it's very obvious actually. It's just really hard to do. It's really hard as a patient who's been eating the same thing for 20 years and had a trauma that happened to them. For example, their child passed away, unfortunately. And then after that, they developed depression. And then after that, they became isolated. And then after that, they started eating unhealthy, and that became their therapy to eat. And then they gained weight, and then they got hypertension, and then they got diabetes, and now they have COPD, and now they have sleep apnea, and now they have 6 chronic conditions that all stem from one thing. And they come into your office and you're asking them, well, stop eating this, sleep better, and do this. So it seems obvious, but the actual practice of lifestyle medicine, it really takes a special, unique individual to relate to the patient. And the best part about lifestyle medicine, and I can tell you because I see outpatient OBGYN, you have such a small amount of time with patients. It's really sad. It's hard to get to know your patients. Thankfully, I've been there long enough, 3 years, that my patients come back to me and I know them and they know me. But it's really hard to see a patient in those 10 minutes and really understand what's going on in their life and be able to give them the right counseling for them to really feel cared about. Because at the end of the day, when patients go to the doctor, if they don't know you care about them, then they're not going to do anything. So lifestyle medicine is a really unique field because in general, you get more time with your patient. So the visits can be 40 minutes, it can be an hour. There are multiple sessions. Maybe you have one session a week, maybe you have one session every other week, but it's a very personal field, well, where you get to address these 6 behaviors. So the main factors are nutrition, physical activity, restorative sleep, stress management, social connection, and avoiding risky substances. So we are not going to go into each of those individually because each one of those would have individual lectures on their own. We can briefly do an overview of what we mean by what is nutrition and what's recommended for physical activity. But later on, you can invite me back and I'll be happy to go into specifics. So when we talk about nutrition in lifestyle medicine, we're talking about a whole food, predominantly plant-based diet. So it consists mostly of fruits and vegetables and whole grains and legumes and nuts and seeds, minimally processed foods. So definitely in lifestyle medicine, recommendations would be against ultra processed foods. So for example, an apple is a healthy food, it's not processed. When you get to applesauce, that's a minimally processed food. And when you get to, I don't know, an apple muffin, for example, that's an ultra processed food because ultra processed food has multiple things added to it. It's been changed, it's been heated, it's been boiled, all the nutrients are gone, and then you're just adding crap to it. The problem is when we think about heating and cooling food, when we think about adding things to food, it changes the components of food, it changes the nutrition of food, but it also adds things that make food bad. So for example, if you like to cook, and I didn't know this before lifestyle medicine, but it's better to boil food than do other ways of food. And there are certain temperatures because different enzymatic processes, and it's common knowledge, enzymatic processes happen at different temperatures, but there are specific recommendations that have been linked to cancer formation and Alzheimer's disease and dementia. So even the way you cook, even the temperature, even if you heat your oil too high before you fry your onions, you're actually poisoning yourself. So when we talk about nutrition and lifestyle medicine, we're not just talking about eat healthy, don't eat chips. We're actually talking about the process where your food comes from. We're talking about how you cook it, how you consume it. So then, let's skip that. These are top encouraged food groups. So vegetables, fruits, whole grains, legumes, pulses, nuts, seeds, low-fat dairy, and fish, seafood. Most discouraged food groups, so fatty meat, refined grains, processed meat, and red meat. Just a side note, again, a more specific example of talking about um, lifestyle medicine and what you learn and lifestyle medicine about educating patients. So food labels are really important. So for example, when you go to the grocery store, I've always been a pretty healthy person. I've always tried to stay in shape. I've always eaten pretty good. Um, but I didn't really know how to read food labels, and I didn't know what bread was better or worse for me, to be honest. I knew white bread is bad, everything else is better, but I didn't exactly understand. So whole grains specifically have been shown to decrease many different types of chronic diseases and also cancer. So that is why whole grains is up here, but lifestyle medicine teaches you how to read food labels and talk to your patients about food labels and what they're specifically ingesting over a day, over a week, and over the long run. Because the pattern that we eat, it's not just like, I'm not going to say it's bad. Don't go home and eat a donut. Like, that's so bad. No, go home and have the donut, but don't eat a donut every day. Have a donut every once in a while. Perfectly fine to eat a donut. But every day of eating something bad is not good. So if you're going to the store, you don't know how to read a food label, and it says um, whole grain. Well, actually, a lot of these are not FDA regulated. So unfortunately, when we're reading the front of a type of food, it's more important to read the food label because they can put false advertisement on the front of the bread. So it can say whole grain on the front of the bread when it's actually not. So it's really important to look at that. So that's just one example of another way that we look at nutrition and lifestyle. Okay, I'm just going to go quickly over this. Physical activity, I already mentioned 150 minutes a week of moderate to vigorous intensity exercise is recommended. Then restorative sleep. They found that women need more sleep than men, at least 1 hour more a night. 7 to 9 hours of sleep is optimal. I know in medical school you guys are busy and studying, but it's important to get your sleep so that you can really focus on doing the work and taking the test. Because if you're sleep deprived, you're not going to, even if you are brilliant, and I know you guys all are because you're here, you may not do as well as you can. Also, stress management. There's a lot of teaching in lifestyle medicine about cognitive behavioral therapy, mindfulness-based stress reduction, sleep training. There's a lot of studies related to poor sleep and development of disease, not only in the time that we sleep, that 7 to 9 hours, but also interrupted sleep. Something that is going to really impact you guys when you start doing your clinical rotation, you're going to be on night shift. And some of you may do better with, adjusting to night shift. Some of you may not do good with adjusting to night shift. When I was in OB/GYN residency, we would do a month of nights straight. It'd be 14 hours a night, 6 days a week. So that's a lot, right? And your body gets used to it eventually. But when it's time to switch back, like you have that one day off, you have to follow the same pattern. If you don't, your brain and your mind, like you can't work together. So I was in a field where I'm doing surgery, but you can't function. So you guys have to take care of yourself. You have to take care of your sleep and your stress. You really have to think about going from days to night. You need to talk to your housemate, hey, or pick a different housemate if music is too loud. But I remember like I was living in a construction zone. Like I was on nights and they just started construction because the water pipe broke. So in the day, when I was trying to sleep, they were drilling. And then at night, I was awake. So it was like being awake for weeks at a time. At some point, that's dangerous. So you need to stop and recognize and make sure you're tracking yourself. Because when you're depressed or when you're sleep deprived or when you're stressed out, you actually don't even realize it because you're keeping going, keeping going, keeping going. So these things are really important. It's not just about the time that you sleep, it's about the pattern that you sleep and overall how your quality of sleep is. And it's all related to chronic disease. In night shift workers, the people who work on chronic nights, they have a 24% higher overall rate of cancer. That's crazy. Like just your sleep. Like if I was working night shift, that's enough for me to say like, no, it's not worth the risk. So this is about lifestyle medicine, but also general advice as you're going through your training. Think about what your goals are, what your priorities are, and also take care of yourself and your health because that's what's most important. If you don't stop and reflect and take care of yourself, you're not going to get where you want to go. Okay, avoid risky substances, drugs, alcohol. Yes, alcohol is safe in moderation. We're talking about excessive use, excessive drinking. Also, e-cigarettes, relatively new in the last few years. Hopefully in the next few years, we have more guidance on e-cigarettes, but e-cigarettes are not necessarily safer alternatives than tobacco. They still have chemicals. It's just a different form of getting the substance. And then social connection. So this is really crazy. One of the main indicators of how long you will live is if you are not socially isolated. So when you see an 85-year-old, a 95-year-old, a 100-year-old, what is impacting how long they're living is not necessarily how high their blood pressure is or they're smoking. If they're in a loving family, if they have a partner, if they have children around, being in a community. And this was the most surprising aspect of lifestyle medicine to me that just really surprised me that having just a social connection impacts how well you live and how long. Okay, so lifestyle change is a first treatment option. It's recommended by multiple different task force, different colleges. So these are going to be examples of where lifestyle medicine is recommended. So the USPSTF recommends lifestyle medicine changes for cardiovascular disease, healthy weight loss, obesity in children, prediabetes, smoking in pregnant patient children and adults, perinatal depression, alcohol use, drug use, fall prevention, breastfeeding, there's many more. The American Cardiology and the American Heart Association also recommend lifestyle medicine as first steps. They're circled in red. I know it's really hard to see, but the main point is just that these big organizations and associations are recommending lifestyle medicine to be incorporated into treatment. This one is from the International Society of Hypertension and Global Hypertension. So again, the first thing is lifestyle advice. This is from the Joint National Committee, who recommends lifestyle medicine as the first treatment and prevention for hypertension. This one is from I believe, the Endocrinology Association, who has recommendations for nutrition, physical activity, sleep, behavioral support, and smoking cessation. This is from the ADA, who is recommending lifestyle behavioral changes. Again, endocrinology, heart association, cardiology. I forget what AICR stands for. I think it's the International American Institute of for cancer research is also recommending these lifestyle modifications. The WHO for reduction in chronic dementia. Also, lifestyle medicine is being incorporated into many surgery specialties for pre-op before patients go to the OR. Many times they're going to have patients that ask to be sent for bariatric surgery, and then the surgeon sends them right back to you because they need to lose weight. If they have a higher morbidity and mortality, if you're over a certain amount of BMI. So lifestyle medicine has been really important and fundamental in many surgical specialties. Then just very few data. So this is some data showing that lifestyle medicine is important to reverse chronic conditions. So this is talking about remission of diabetes. There's been several studies showing that in a newly diagnosed diabetic, that lifestyle medicine versus medication such as metformin after 3 months, 6 months, 9 months, 12 months, 5 years has the same effect as the drug. So again, this is only one example, but there are many, many examples of where lifestyle medicine is treating and reversing chronic disease. So this is called the quintuple aim, and lifestyle medicine works to achieve that. So I think I'm going good on time. Hopefully I'll finish in the next few minutes. So in medicine, unfortunately, as we go forward, you'll learn that medicine revolves around making money. Hospitals making money, practices making money. You have to make money, you have to pay your bills. You have no student loans. Hospitals have to pay you. So one of the ways that lifestyle medicine is important is that it's found to reduce costs significantly. If an organization or specialty can reduce costs, that's huge in medicine. So that's why lifestyle medicine over the last few years has really taken off. It's not that it's preventing disease. It's not because it's curing disease. It's because it's saving money. So that's the bottom line. So as you think about, medicine and seeing patients and making money, just keep in mind lifestyle medicine along the way, because it really does outnumber treatment with medication, like 1 to 16 or 1 to 20 in some ways. So the other aims are advancing health equity, improving population health. Patients are overall happier, so enhancing the care experience. Patients feel supported, they feel heard. Like how often? Like I was at the gym the other day and I was hearing this lady like talking on the phone. She's like, I went to my GYN and I sat there an hour in the waiting room. And she was like, and then I went to the room and they had me undressed before they even came in. Like they just gave me a sheet and then I sat there for like 20 minutes. So in lifestyle medicine, you can interact and be more careful with patients. You can give them more of your time. There's less pressure for documentation. There's less pressure overall from hospital systems. And patients are generally overall happy if you just sit down and look at them instead of like in my day job, I'm telling you, like when I'm seeing GYN patients, I'm literally, they're talking and I'm like typing, which is terrible. I try to look up and make eye contact, but if you don't make the eye contact, like they just are like, then they're on the phone. I waited an hour in the waiting room and then I sat there in 20 minutes and I'm never going back to them again. So, I mean, you're the person they trust the most. Okay, so my mom, another example. My mom visited me over Thanksgiving and she's like, I have something to tell you. I'm just so relieved. And I was like, what? Like, and she had texted me like on WhatsApp like a week before, like, I got good news. I'll tell you in person. I'm thinking, what? Like, what can't you tell me? Like, why can't you tell me? Like, just text me what's going on. So she comes and she's like, I had a scare. I was like, what are you talking about? She's like, I had a lump. I was like, what are you talking about? Like, she's like, in my breast, the doctor felt a lump. And they told me I probably had cancer. And I was like, I am an OBGYN and you didn't tell me you have a lump in your breast? She's like, it's okay. They did it. It's not cancer. It's fine. Your parents, your siblings, your aunts and uncles are not going to be telling you this stuff. The stuff that they're concerned about, they're going to be telling their doctor. They're going to be telling you guys. So think about really giving each patient just one-to-one attention for a minute so that they can tell you what they're worried about. Because they're telling you, they're not telling their daughter or their son. Maybe they are. But overall, they're looking to trust you. They're looking to trust you guys. They're looking for you to get them diagnosed and treat them and calm their nerves and take care of them and then send them back to their family and say, oh, it was okay. It was just a scare. So yeah, lifestyle medicine enhances how patients feel, their experience. And then also the doctors have. So this is a really sad number that I'm going to tell you, and you probably already know, 40 to 50% of medical students are burnt out. Guess what? In residency, 40 to 50% of residents are burnt out. Burnt out is not just like sad or tired. Like burnt out means like you're done. Like you can't function. It's a bad situation. So like half of this room right now, I know you're MS1s and 2s, right? Right? MS1. Okay. You guys are just beginning. So again, the selection of lifestyle medicine, but the whole premise is to take care of yourself and your lifestyle. So as you go further along, support each other. All right, I better get talking faster. So lifestyle medicine has great benefits, improvements of all of these chronic diseases. And then lifestyle medicine I already talked about is cost effective. There's actually research behind all of these things I'm talking about with multiple randomized clinical trials. Again, lifestyle medicine equals provider health. Generally, doctors are happier and physician burnout is lower. We talked about lifestyle medicine improves patient satisfaction, and we talked about health restoration. So again, lifestyle medicine is not just about prevention and reversal of disease, but maintaining your health. It's really important when we think about medicine that we're not just thinking about treating something, but we're thinking about really maintaining and restoring. Like I have a good friend who's like a plastic surgeon, and I think that's great. He loves what he does. Like it's an art, and if you want to be a plastic surgeon, everyone needs a plastic surgeon. Like go for it. Be that person. Be that artist. But then I'm like asking, like, so you suck out their fat, and then what if like in 5 years, like they're still eating the same things and the fat just comes back, then you have to suck it out again? So it's just confusing. So you need multiple doctors, you need multiple specialists, you need people in different specialties. So you need the plastic surgeon, sure, and you need the lifestyle medicine doctor. You need the health coach. You need to combine for patient happiness and satisfaction and overall health. You need everyone. Okay, so what is ACLM? So they work, it's the American College of Lifestyle Medicine to advance evidence-based lifestyle medicine treatment to treat, reverse, and prevent non-communicable chronic diseases. It's an organization that's not just in the US, but it's international. It's made up of a bunch of professionals, so not just MDs, COs, PAs, NPs, but also other people who have expertise based on their training. So nurses, physical therapists, registered dietitians, wellness coaches, I can't see them green, pharmacists, social workers, mental and behavioral health. So since 2020, the growth rate of memberships has grown a lot, which this is a significant growth. If you look at any other college, the growth is either plateaued, stays the same. This field is taking off. And I guess it's because I think it's because physicians and other people who have other backgrounds are overall healthier and they can really take their time with patients. But the field is just taking off and it's very surprising. So there's Jennifer and Layla, and that was us at a conference this weekend. They came with me to see Dean Ornish speak. Dean Ornish is one of the founders of the American College of Lifestyle Medicine. And this was in Washington, D.C. just this Saturday where we went to the APPM conference, the American College of Preventive Medicine conference. And I put this slide up here just to recognize them again, that they started this group together and they've done a phenomenal job. So lifestyle medicine interest groups have been in medical school since 2009. Now there's 90 medical schools with lifestyle medicine interest groups. And then I think in the beginning I mentioned that, I don't know if I mentioned this, but our preventive medicine program is implementing the residency curriculum for lifestyle medicine, so you can become board certified in not only preventive medicine, but also lifestyle medicine after completion of your training. Lifestyle medicine does not have a separate residency program. So you can't just go into ERAS and apply to lifestyle medicine. Maybe it will in 10 years, I'm not sure. The way to get training specifically in lifestyle medicine is to find a residency program that has it built in. Right now, there are 135 hospital sites, and there's 302 residency programs within the site. So at Maryland, our program, the preventive medicine program, will be the first to have the lifestyle medicine curriculum in it. I think Lily said there's 3 others in Maryland. PM&R at Hopkins. There's one down south at the University of Maryland. I think it's a family med, and there's another one. And that's me. Thank you. If you have questions, write down my email. Feel free to email me later if you have a personal or private question. If you want to talk to me, I'm happy to. And we can talk about general questions. Anything? Yeah. Hi.
Thank you so much. This is really interesting. What is the difference between lifestyle medicine and functional medicine?
Yeah, so lifestyle medicine more focuses on the 6 domains that we talked about, where functional medicine is more of a general overview. Functional medicine combines complementary medicine with traditional medicine. So there's a lot of approaches of complementary medicine and functional medicine that aren't necessarily recommended right now by lifestyle medicine. Lifestyle medicine is more evidence-based. There's a lot of randomized clinical trials behind all the recommendations of lifestyle medicine. I am a firm believer of some of the complementary medicine approaches. Like, I've had acupuncture done on myself before. Is there evidence for it? Not really. It's really mixed. There's terrible evidence for acupuncture. So that's something that a functional medicine doctor may recommend, but that's not necessarily what lifestyle medicine. So that's just one. Yep.
So are your own challenges focused on lifestyle?
Preventive medicine.
What is it like traditionally to like for the PMR and other residents to have it integrated? What's the difference?
What is the difference between different? So you mean, okay,
Like
so
what is the training like in those like integrated programs? Like separate?
So I did not, so I did OBGYN preventive medicine, and then as a faculty member, I was able to do a special track. I didn't have to do another residency in lifestyle medicine. So the way that I did it is different from how you all would be doing it. Unless you become a faculty member and then one day want to get the certification, and that pathway still exists. The lifestyle medicine residency curriculum training within residency programs is built in. It does not extend the time that you're in that residency program. So right now, our preventive medicine program is 2 years. When the curriculum for lifestyle medicine is built in, it's not going to extend that time. So it's not going to make it 3 years. If it's another residency program, it's not going to extend the time. It's just that it's built in, and you may be doing different rotations than some of your other colleagues. So our program is not going to institute that everyone who enters our program does the lifestyle medicine curriculum, because it may be a little trade-off. But if you're interested, then we can make it work. Does that answer your question?
Yeah, that was follow. For the residency programs for integrated, like work application, pressure. Is that only if you get the certification, like become board certified, or how does that work?
So every residency program is extremely different. Every specialty is extremely different. I would say that as a practicing lifestyle medicine physician, you can create your own path. You can create your own clinic. You can own your own practice. So you can allocate for yourself how you want to spend your time and what your hours are. At the meeting on, I think, Friday, one of the graduates from a few years ago from here is not boarded in lifestyle medicine, but because preventive medicine has an aspect of lifestyle medicine. She now owns her own lifestyle medicine practice. And she sees 4 to 8 patients a day. And she's like, I rarely see 8 patients a day. It's just more relaxing and I get to know my patients. But specifically in residencies, it depends on how that residency is built. ACGME has general requirements for residency programs, but it's really specific to where you go and what specialty. Yep.
I have a question on the nutrition.
Yeah.
Great.
Mhm.
But also acknowledging for other people,
Mhm.
like how to really have that conversation of also the bad we have the own purpose of having it. And how do you have a conversation about not grouping and
Yeah, you make a good point. You're absolutely right. Yeah, lifestyle medicine does our best, not to say this is a good food, bad food, but in general, recommendations to be more plant whole food based. But what you're talking about is definitely in the preventive medicine world as a preventive medicine physician, and you're talking about food deserts, and that needs policy change and that needs programs within those areas. So those patients can access healthy foods and you can provide them with recipes for healthy foods, but definitely it's a challenge. It's a challenge for me who has, now I'm working, so I can go to the grocery store and spend, I bought a mango, it's like $3, but everyone doesn't even have a mango in their grocery store. So you're right, within this area, within like the mile area, there's a food desert. There's a huge food desert right across MLK. So that is a very good point. Not all people are going to be able to follow strict recommendations. So that's something as a physician, that's one of the arts. You need to understand who you're talking to, where your patients are coming from, what they have access to. So that is a very important question. And I would say it's a skill that you learn in medical school and residency and an art to really see which patient is sitting in front of you. Because the patient at 8 o'clock is not going to be the same patient at 8:20. They come from completely different places, live in completely different worlds, have completely different stresses. So that's a great question. Yeah.
Um,
Yeah. Say that again. Sorry, you were talking about.
The root causes.
Okay. Yeah.
I get broad, like, what I've noticed is truly different from the US, like, for things are possible and also like our food that we have is like very high process per day.
Yeah.
I don't know a lot of like very for like some of your lessons you have to figure out we want to you might buy like even something as like a healthy as opposed to US, kind of different kind of to buy things so in Italy it's a lot of so I just want to wonder if lifestyle medicine and like prevention medicine are also like lobbying for the government for some kind of root causes to like make our city, more walkable and also like have more stringent laws regarding development. I know it's like you get like, oh, it's not really on top, but like also at the same time, it's not that, and how kind of support that intersectionality and
So good question. If you're interested in that, you would be the perfect preventive medicine physician. So lifestyle medicine is really about individual patient care, patient recommendations. Preventive medicine is looking at populations and regulations and policies and guidelines and changing actual laws. So we're talking about people working in the FDA who are regulating what goes in food, what drugs are passed. We're talking about EPA. EPA last week, thank goodness, finally, is regulating PFAS. We know PFAS is causing cancer. I don't want to drink water with PFAS. I'm going to cancer. EPA is finally regulating fats. We've known it's going to cause cancer for years. The people behind that are preventive medicine doctors. So when we're talking about what we're consuming, what we're eating, making cities walkable, you're talking about people in public health departments, private sectors, industries like pharmaceuticals. You're talking about people in insurance companies. You're talking about governmental agencies like NIOSH, FDA, CDC, OSHA. That's where preventive medicine comes. That's not where life comes.
Yeah. And I don't, and I don't, have you ever recommended?
I have not.
I
That's,
just wondered.
yeah, I think that would be really patient dependent. If that, if the patient's evaluated and that would be indicated as a huge hardship or stressor, usually you have to think about risk and benefit of moving versus not moving. So it may actually cause them more harm for them to actually have the stress of moving, finding a place, resources, money, time. So I haven't, but that's something to think.
On the residency question.
Yeah. Yeah.
And other programs like the chief that are integrated by.
You know, I think there are. So you can go to ACLM website and under education, there's the residency program list and every program is listed. So you'll be able to see there are many specialties that are incorporating. It's not just family med, internal med, preventive med. There are many. Yeah. Yeah, so I can not just talk about patient, I can talk about my husband. So my husband's from Iran and he like is born on rice and kebabs and meat and yeah. So he's an educated person, he's an engineer, he's very smart. But talking to patients and talking to family members is not that different, right? Like you need to find out what motivates them. So for my husband, for example, his grandfather, he watched a very smart man, like he was an architectural engineer in France and Paris. He had built like an iconic building and he was brilliant. And he watched his grandfather just lose his mind and showing him studies and study after study after study after study that show that meat eating, red meat, is related to developing Alzheimer's and dementia. You know, that clicked for him. So yeah, I wasn't able to like flip the switch and like never eat kebab again, but it's less. So he consumes less. So when you talk to patients, again, you need to understand where they're coming from and what motivates them. You can't just say like eating this is bad, eating that is good. You have to think about goal setting and who the patient that's sitting in front of you you're talking. And if you find that link, what triggers them to say, okay, like I am eating unhealthy and I don't want Alzheimer's and dementia, then that makes it very real for them. Like my husband he's so scared of that. He had a conversation with me. He's like, take me overseas, take me to Netherlands. If I get dementia, promise me you will basically euthanize. He told me that. So you like people have these fears. So you have to find out what's real to them, and then you'll be able to understand where they're coming from and what motivates them. If you don't find out what motivates them, telling them like don't eat meat, it's bad for you, it's not.
It's one. But
That's okay, you're okay.
I was just curious how insurance fits and like how we're compensated, because if you're spending an hour with a patient, you're not providing like teachers, whatever, like I was just curious how.
Yeah, so there are many different models. that every lifestyle medicine doctor, depending on where you're working, utilizes. A lot of lifestyle medicine practices are doing either a self-pay model or not necessarily concierge medicine, because it's not concierge medicine, but are being supplemented that way. There are a lot of work being done around insurance companies. CMS is now covering some lifestyle medicine approaches, the Center for Medicaid and Medicare Services, and expanding the coverage. And once that expansion happens, the hope is that insurance companies get on board. At the end of the day, hopefully, and it seems to be going this way, we're shifting to value-based care. What is value-based care? And it's looking at outcomes. So we know in lifestyle medicine that our outcomes are really good with not a lot of money. So everyone's getting behind that. So I think two people are going into lifestyle medicine too, because it's very much up and coming and needed, but because it is being backed, it's starting to be backed by large corporations and hospitals and insurance companies. So it's definitely something that's coming, but right now there's multiple different models that exist for people. You guys have been awesome. And my office is right down the hall in Howard Hall, 200 through the Public Health and Epi Suite. I'm good.
Thank you guys.